Okay, moving on to our fourth and final panel for today. Where to go from here? Developing LGBT informed mental health services. So it gives me huge pleasure to introduce our next speaker. I've had the pleasure of speaking to so many times on radio. Vanessa Lacey is a health and education manager at TENI, that's Transgender Equality Network of Ireland. You're very welcome, Vanessa. And Vanessa is going to be talking about training on LGBTI plus mental health services. Where are you joining us from, Vanessa? Are you in Waterford? Vanessa, can you hear us? Oh, you're.
I can hear you. Can you hear me?
Great. Yeah, all set. Where are you joining us from today, Vanessa?
I'm in Spain.
In Spain. How lovely for you.
Working for, yeah.
Okay, I'm so jealous. Take it away, Vanessa. Tell us more.
So thanks a million. Really, I think we're looking at developing LGBT sensitive mental health services, and really, I suppose the best place for me to start is at the start. So really, where have we gone from here? You know, one of the big, and listening to, you know, the brilliant speakers on there this morning, and I would have known many of them, had the privilege of working with many people on there, especially the young people as well. You know, one of the biggest stressors for transgender people, both young people and older people and family members, is accessing healthcare. And really the research would suggest that that is the area that impacts more on quality of life for people. So I think really the services that we have providing trans-specific healthcare to trans people and their families is I think absolutely far away from what international best practice is, and I think we are a fair bit away from where we need to get to before we have a service that you know, when you're looking at the marginalization and the minority stress experience for transgender people, and then there's a service in place that is supposed to meet our needs, and it is still far away from where we need to be. In terms of an adult service, which really the historical aspects of that service that is based in St. Columkills, originally under Professor Donal O'Shea. It was an obesity and a diabetic clinic, really, that just saw transgender people as well, and no funding really was into that until half a year ago when Minister Byrne announced positions there. We were instrumental in making that happen. We advocated for that in TENI. We worked very closely with the Quality Improvement Division and all divisions actually in terms of an professional announced, and then unfortunately that was the last of our engagement with the services. So they developed a criteria that was not based on international best practice, and then they announced a new clinical lead, which is Dr. Carl Neff, and I must say he is one of the most, I think, the most positive aspects in respect to transgender health going forward. That's where we were. I think that the issue resides, I suppose, when you're looking at national standards for better, safer healthcare, which absolutely situates the trans people or the person themselves at the centre of our care. We have not been at the centre of our care in the National Gender Service, and has caused insurmountable problems for transgender people in healthcare who are referred on to that service at 17 years of age. Minister Byrne also announced 5 new positions at that time for younger people's transgender health related services in Our Lady's Children's Hospital in Crumlin. And that's in a worse state, unfortunately. You know, that's where we are this morning. I was on to the corporate manager there this morning because there was some issues there. But, you know, certainly it is a long way away from where we expect to be. The clinical lead in that service has left. I had some news this morning that I can't share with you because the letters have gone out to all the clients or the families of the clients who actually accessing that service. But it's just to say it's not bad news. So in terms of where we are or where we were is not good. Where we are, we have major challenges we absolutely need the National Gender Service, and as I already mentioned, Dr. Karen, for more engagement. Certainly I'm very open to engagement, and we should be part of the governance committee in there, which was suggested and recommended by the government and the Department of Health. But we're still very much marginalised out there. And you know something, Dil, and everybody, you're talking about a transgender health service, a specific transgender health service in 2020, and there's no transgender representation on a governance committee of that, and no transgender people even employed in that service. So what does that say to 17-year-olds or 18-year-olds or 40-year-olds or 62-year-olds who are accessing that service? They feel it's about us, but absolutely without us. So that's an absolute situation that's going on in the National Gender Service. I think really going forward, and maybe, I am an optimist, I suppose, I am an optimist. And as much as there are major cracks, there are major problems, absolutely, we're in the middle of a pandemic, but let's not blame the pandemic for the state of the National Gender Service and the Adolescent and Child Service in Crumlin. Where we need to be going is, I believe, is the developing services that are based on interest practice. I think that's an essential thing that we need to be doing. We cannot situate ourselves outside of what everybody else is doing around the world, based on the experiences of a couple of consultants, rather than the experiences and the research evidence that's available worldwide and from world governing bodies, as in the World Professional Association of Transgender Healthcare and its sister organization, the European version. So I think that's an initial thing that we need to face up to and move forward to. There was a report that was commissioned by Minister Harris a year and a half ago, and that report was sent to the Department of Health in January, but it still hasn't been published. And still, certainly going forward, that report needs to be published, and then recommendations need to be acted on. So that's in terms of the adult service, and also the recommendations that were also in respect to the younger person service, so to develop that multidisciplinary team that's needed. Going a little bit further than the specific services, really what I would like to see, and I think really, again in 2020, what we would want to see is the service moving out to be regionalised, and this is where our trainings come in. So in terms of TENI's trainings, we used to deliver full day's training to health professionals, on average 50 trainings a year, full day trainings. However, with the pandemic and with the public health measures, we have adapted our full day training, and it's now half comms in September, and we started training in October. I'm now actually booked up into May 2021 in terms of the full day trainings, which are 2 half days. We have also recently been successful in getting funding to develop HSE land training for transgender healthcare next year as well. So it's very, very exciting. And also we have developed and piloted and evaluated a 3-day training, a 3-day extensive training called Gender Identity Skills Training. So really with the 3 of them trainings, it's to take it from the HSE land area, the 1-day foundation training online, or 2 half days, should I say, and then the 3-day extensive training. Our hope would be to train health professionals throughout the country, that in a space of 3 to 5 to 7 to 10 years, that people's experiences of accessing healthcare would start to get that little bit better. So whether it is a counsellor, whether it is a psychotherapist, whether it is a psychiatrist, that they have a better knowledge of the area. And whether you're in Letterkenny or Listowel or Lisdoonvarna, you should be able to access the same form of transgender healthcare. If there is more complex issues, the services that are regionalised can link into the national service and be supported on there. We're also Irish College of General Practitioners, So GPs are central to Irish transgender healthcare going forward. So that's another exciting that we're in, and we were very much again in TENI very much part of that. And again, just a massive shout out to Paula Fagan and LGBT Ireland for linking us in to make that happen. So really appreciate the help from our LGBTI plus colleagues as well in the area. So I think really going forward, I think again a number of things need to happen. I think the trainings need to keep on going. We're very, very excited about that. Over the last couple of days, a very exciting development where we were contacted by Board Fáilte that maybe there's a potential of maybe having a massive international conference in the next couple of years on transgender healthcare. And I think, you know, really that would rather than the conference itself. So hopefully we would be in a position, and our country would be in a position, and our government would be in a position to sign up to international best practice at that time. We would be working in tandem with both the national services that are based in Dublin and also the regionalised based services at that time. I would really hope that we would see that Ireland transgender people in the world, 2.5-year waiting lists or 3-year waiting lists, and feeling that they have to access online services. So like at the moment, we're in a dismal state, but at the same time, we are working and forging ahead to make them change and collaboration. That's where we are. We work with the situation holistically. We work, I mean, training and health-related training is only one part of it. We are in the process also of writing up a policy for general healthcare for transgender people. So that's being done. I would think that we need to have more positive reflections of the first trans politician happening, and hopefully that will emerge over the next couple of years. But I think it needs to be, you know, looking at some of them inspiring young people there a few minutes ago, maybe they could be the politicians of the future, and they can be the psychologists of the future, and they can be the mental health professionals of the future, because that's where our future lies. So to Yvonne and mental health reform, and thank you so much, Dil, for a wonderful facilitation of this really well. So thank you.
Thank you so much, Vanessa. So lovely to see you and hear you speak after so long. And I'm jealous that you're in Spain. Spain. I wish we could all be in Spain with you. Yeah, no, and it's, you know, it's so funny. We've had this conversation so many times. I've heard you speak so many times, and yes, there is advancements, and yet at the same time, as you use the word abysmal is the word that kind of stuck in my head, because that is really encapsulates you know, that it's about us but without us, you know, how, you know, anyway, thankfully you're working hard, and there's so many organizations who are pushing for this, but it is something that really needs to get talked about, because we need trans people at the forefront of the service provision, because it's just, you know, when you see, it's just the amount of comfort that the service user would get, knowing that the service is being provided by one of their very own people of their own community, because you know how only you know how difficult it was to walk in those shoes, and you know, navigating the Irish gender identity journey. Only you know, because everyone else is completely clueless of just how difficult it is.
Until, you know, the situation is from, you know, from whether the person who is accessing that service is 9-year-old or 90 years of age, you know, and you know, we've worked with young people of all ages and their families, and families who are struggling with the challenges that they have in terms of the young person or the older person transition to trying, and the limited supports for everybody in respect to that issue at the time. So, you know, I think we need to you know, I'm delighted to see the work that LGBT Ireland are doing in respect to older people, because, you know, uh, we as human beings have a habit of getting older, and certainly we as trans people are getting older, and I absolutely can tell you that that's happening here too. So, you know, as we get older, trans people get older, we know also need to have specific related healthcare for us in that regard as well. So hoping that we can work very much more closely, I suppose, with LGBT Ireland over the coming years to and maybe do some research into that area in terms of older trans people here as well, big components of that. So, you know, again, just thanks a million.
Yeah, absolutely. Because we heard from Sean Vale's experience about being an older gay man and the definite needs for healthcare services in relation to him. Absolutely, we need to look into the element of this, the support services for older trans people. Now, moving on to our next speaker is Dr. Aileen Murtagh. She's a consultant child and adolescent psychiatrist and assistant medical director with special responsibility for adolescent mental health services in St. Patrick's Mental Health Services. Aileen, can you? There you are. You're very welcome.
Hi, thanks so much for a great morning. Really enjoyed it.
Oh, it's been a fantastic. I'm in bits here. I'll be going to therapy after this because there's so much there to process. Anyway, take it away, Aileen.
Perfect. Well, I think I'm going to Spain after this. I've been tempted now by hearing Vanessa's enjoying the Spanish delights, and I think hairdressers are open in Spain. If I'm not correct. I hope everyone can see my PowerPoint presentation there. I suppose I work in adolescent inpatient and outpatient services at the moment, and I've really been struck by how many more and more young people, particularly in recent years, are raising issues in relation to gender or sexual identity, and they want to talk about it. Sometimes it is directly related to the mental health issues, but not always. And it is important that there is that safe space to talk about it. But not uncommonly, I am hearing that young people have tried to raise this with other clinicians, and it's shut down because I suppose they're often told we'll talk about the mental health issues, but we don't feel we've the expertise or the training to talk about, gender or sexual identity. So it's just parked, which isn't helpful. And we know that internationally, the number of transgender youth that are referred not only to specialist gender services but also generic mental health services are increasing exponentially. So it's really important that we can meet the needs of this community. So it's great. I think in Ireland there's a lot more training. A lot of the people contributing today are involved in training and clinicians and services raising awareness, which is so positive, and the webinar as well, obviously. And it's been a fantastic morning. So moving on, I suppose I'm just going to talk briefly about service experiences and just, I suppose, some basics about, what we can do to make it a more friendly and inclusive service for young people. So why, I suppose, do young people interact with mental health services? And I suppose the LGBT community might be referred because they're suffering from stress, anxiety, depression. There might be body image dissatisfaction. They might be engaging in eating disordered behaviour. I'd work with some trans males who do restrict their diet and over-exercise because they're very dissatisfied with body shape. They're trying to alter it. And as Vanessa referenced, they're on long waiting lists to be seen by endocrinologists or for special assessments. So it unfortunately can lead to altering eating patterns. Sometimes there's issues with relationships, whether it's with friends or family or romantic partners. There can be deliberate self-harm, suicidality. Sometimes gender diverse youth ask for referrals because they or their parents are seeking advice on transitioning, whether it's social, legal or medical, or they're seeking access to hormonal treatments. And unfortunately, there's a lot of research out there which does mirror our experience on the ground, that with this community, there is a high degree of psychological distress. So it is important that there is open and friendly spaces and services for them to access. So what are the barriers? Back in 2013, the Speaking from the Margin study, I suppose, highlighted that there was a lack of awareness, training and knowledge, in mental health services, and in particular in inpatient services, that, trans people felt judged. About a third of them felt that their gender identity was treated as a mental, illness in itself. And worryingly, 40% were not seeking urgent support due to their trans, status and fear of being rejected, not listened to, not taken seriously by services. And issues in relation to single gendered areas in inpatient units were raised as well. And again, in that same study, worryingly, about 2/3 of the respondents had at least one negative experience with both a general health service and a mental health service. And about a third of them felt that they actually had to educate the healthcare professional about trans issues. And in 2017, which is a couple of years on, but I suppose that study found that it was still a major barrier accessing healthcare, a fear of rejection or negative attitudes by service providers. And another study in 2019, which I think has been mentioned by a lot of speakers today, that really there is such a need for increased training and awareness to address these issues. And I suppose my own belief is that all healthcare providers, not just in mental health, because obviously LGBT youth come in contact with GPs, A&Es, they need to go in for surgery. I do think everyone should be trained in some basics, and certainly I think an awareness of the terminology. I mean, a lot of young people tell me that they've said to a clinician that they're pansexual and non-binary, and they have to explain what they mean by both terms because it's not understood, and that's not really conducive to a safe space to open up. Or I think one of the young person there who spoke on the panel said they want to chill when they come to services and just talk openly, and you can't really do that if you're explaining yourself. It's really important to ask about, for gender diverse use, to ask about use of preferred names and preferred pronouns, because if you're constantly misgendering the young person because you haven't checked, if you're using, the birth name or the dead name and they've socially transitioned and they're using the preferred name, you start off on a really negative footing. It's really important not to make assumptions, and this tends to happen all the time, not to make assumptions about sexual identity, not to make assumptions about what the preferred name is or preferred pronouns. Sometimes I've worked with young people who identify as male, but they don't want he, him pronouns used. So it is important to check. Or very often there's an assumption when young people come out, they tell me that, their peers say, when are you going to get surgery? When are you going to get hormones? And not everyone does go down a medicalized pathway. So I think there's a lot of assumptions. So ask if you're not sure. There still tends to be, sometimes I see that there is confusion sometimes with parents, or sometimes at conferences where gender identity has been discussed and people think you're talking about sexual identity, and obviously everyone has a sexual identity, but gender and sexual identity are different. And I also think it's important that as service providers, we are aware of the fantastic supports and that are out there, and also to have some knowledge of service pathways, which is a tricky one. I mean, even in the last 5-6 years, there's been a lot of changes in terms of service pathways. So I would still get calls about, what support groups are out there, what's running now in the pandemic, is the service still running in Crumlin? So to I suppose as much as possible to keep up to date with what's happening on the ground. The gender-read person, I think, displays really nicely just the diversity in terms of gender identity, gender expression, and sexual orientation. And to be careful with the word itself, transgender. So some young people I work with really embrace that term and really embrace and are proud to be part of the community, whereas other young people say to me, I am a transgender male, but I don't identify as transgender. I am a male. That's their authentic gender identity. So using the word transgender in sessions isn't helpful for some young people. So again, it's to check. So I think it's really important as mental health, service providers, that we remember that gender is a spectrum. It's a range of expression. It's how people relate to themselves. It's a personal identity. It's not just a simple black and white concept. It's not just male or female. Gender identity is not defined by body parts or sexual orientation. And another kind of common misperception out there, and I get asked this by parents quite a lot, you know, if a young person has just come out as transgender, and parents ask me, you know, if this does constitute a mental illness, and it's not a mental illness. It's unfortunately associated with mental health difficulties, but in itself, gender variance is not a mental illness. And not all people who are gender variant need or want a service or clinical attention. And as I mentioned before, they don't all want a medicalised pathway. Some do and some don't, or sometimes desires can change over time. But there's no kind of one size fits all approach. I'm often asked by parents who kind of come seeking advice for young people, you know, can you tell me how to fix it, or what path we need to follow? And you have to work it out for the individual young person, because every gender journey is unique. So I suppose our experience on the ground in terms of frontline services, and this is borne out by research as well, that trans youth compared to cisgender youth are more likely to need both outpatient and inpatient mental health services. And I've really noticed that in the inpatient unit where I work currently. I mean, the amount of referrals we've got for young people where there is a gender identity issue over the last 4 years in particular really has increased very significantly. But we do know in general, and from talking to our colleagues across the pond and over in America, that, you know, young people are seeking kind of medical care at earlier ages. And research, and again, our experience would show us that often the mental health comorbidities significantly reduce with gender affirming care. Or I'd actually often hear, working with young people, that, you know, that when they come out, that often there's a, you know, self-harm behaviour stops, mood improves. Parents would often say that with the benefit of hindsight, you know, that their young person would have gone through a really tricky 1 or 2 years. They were self-harming, they were low, they were anxious, you know, they were distracted in school. But actually after coming out, and particularly I suppose if they've had a supportive, you know, a support from parents, that actually can be a very positive experience and can reduce the mental health comorbidities in itself. But obviously that's not the case for everyone. So the Mental Health Commission, you know, who very much governs standards of practice in terms of mental health services in Ireland and in inpatient units, they have produced a guide, you know, for staff working in mental health services to meet the needs of the community. And they do highlight the importance of respect. And again, I think one of the youth panel mentioned that, you know, respect is just so important, that they can go to a space where they are respected. That rights are respected, that, you know, it's an inclusive service, that the language that's used, preferred names, preferred pronouns, that there's an openness, and the conversations aren't shut down the minute, you know, a gender or sexual identity is mentioned. And that there is improved training for staff. And I think on the ground in recent years that is improving. So I suppose in conclusion, I can't overemphasize the need for training. And I said my own personal belief is that all you know, people working in medical services do need a basic level of training. And then there should be access to specialist training. And Vanessa mentioned kind of some specialist 3-day training, which I've been involved in as well. I suppose, and ultimately working towards, you know, perhaps a specialist service for young people, you know, nationally, but also regionalisation of services, so people aren't travelling really long distances all the time just to access a specialist service. But to ensure that training does improve so that young people can access truly inclusive services. So I'm happy at the end to take any easy questions.
Thank you. Thank you very much. Thank you for qualifying the easy questions. Okay. So now, who else? Oh, before we take questions, we actually have we'll have the third panelist, and then we'll come back to the Q&A, Aileen. Okay, so perfect. So our third panelist today, again, really doesn't need any introduction because she has been working in this area for many years. So Colette O Regan. She of course is the training coordinator of LGBT Ireland. There's Colette. How are you? Lovely to see you.
Hi, Dil.
Hi. And Colette is going to be speaking about striving towards an inclusive therapeutic mental health setting. This is my my most passionate thing I could talk about. I actually spoke at the IACP annual conference just about 3 weeks ago, and the whole conference was diversity, inclusion, and equality. And I spoke about accommodating or creating a more welcoming space for intersectionality in the therapeutic space. So you can bring all of yourself and not leave any parts of you behind. Anyway, Colette, over to you.
Thank you, Dil. Thanks very much. And what an amazing day we've had so far, everyone. Thanks for staying with it. I'm Colette O Regan, the training coordinator with LGBT Ireland, and I'm so glad that in this session, and even throughout the morning actually, the need for training has been emphasized. Maybe today might be the first time for many of the people joining to get such exposure to LGBT plus issues, terminology, struggles, resilience, the diversity within our community. But please don't let it be the last time you're going to come to learn more about the community. Because I suppose in my experience of training, let me just make a few observations, because so much of the issues have been flagged already through the morning. I experience the perception that people mentioned earlier in this seminar that, you know, since marriage equality, since gender recognition in 2015, everything is now fine for the LGBT plus community. I think everyone who's joined for the seminar can now see that there's still an awful lot of work to do. So it is really important that we get that message out, that while anybody who wants to get married can get married, there's still a lot of other issues in our community that need support and equality. The other thing I want to say is that there's in all of the training work and all of the other work that I do with LGBT Ireland on our issues, I encounter so much goodwill with you know, the vast majority of people that I interact with, and the vast majority of service providers. Everybody wants to do the right thing, and what can make it difficult for people is that just to Aideen's point earlier, the terminology around our community, the diversity within our community, the number of different identities, the fact that some of us have a journey around gender identity and some of us have a journey around sexual orientation. It can seem like, you know, quite an overwhelming amount of knowledge or understanding or letters and definitions for people to get up to speed with. And because people don't want to offend anybody and they don't want to say the wrong thing, they're not sure of what's the right thing to say, they don't want to offend someone, so they end up saying nothing, and then our silence continues, and our lack of conversations about LGBT plus issues and identities and journeys, that it just doesn't happen. So I suppose what I want to say to everyone today is please know that there's tons of training now available for you. Most of it is online, so it's easier to access at the moment, and it's free, so it just costs you your time. So we want you to ask us questions, but of course, yes, we want you to ask them in a respectful way. We want you to know some of the terminology, but it's okay if you don't know all of it, but we want to know that you know something about our community. And I suppose Paula mentioned it earlier this morning, that really means we want you to come out as being LGBT plus aware. We're exhausted from coming out. We're always coming out, you know, even when we're so out, we're still coming out in every new situation. If we don't come out, we remain often invisible. People will just assume who we are, that we're straight and we're cisgender. So if we want people to know who we are, we have to come out. And I suppose you may have got a sense through the morning that that can be really daunting for people. That can be really scary for people. It always takes energy. it always involves self-disclosure of a very vulnerable part of ourselves. And it costs us. The stakes for us when we're coming out are always high, or can be higher in some situations compared to others. So the more that those who are there, whether it's mental health services or healthcare services or social care services or teachers or youth workers, neighbours, families, friends, the more LGBT plus awareness and knowledge is in our society generally, and in our systems, in our education systems, in our health systems, the more people are comfortable with having conversations about sex and sexuality and gender identity. And in fact, the more the majority people in our society are comfortable with those topics, meaning heterosexual people and cisgender people, the more the majority people are comfortable with opening up conversations. And it's easier for the majority people because they are the majority people and they enjoy majority privilege, unlike those of us who are carrying minority stress. You know, we need those conversations to be very normalized. And we need everybody to take their place on the spectrum of sexual orientation. We all have a sexual orientation, but we talk about the minority ones. Fair enough, because you need to understand them and all of that. But what will really help us in the minority to talk about our sexual orientation is if the majority people also just make it very normal to talk about sexual orientations with an S, not just your own, and not just assuming everyone is like you, but just talking about these issues, opening up these issues in the plurals and creating the space for the minorities then to step into it and say, actually, I am gay or I am lesbian. And likewise with gender identity issues, that, you know, so I think through all of the training that I would do and LGBT Ireland does, it's one of the big messages that we try to communicate. And I think it came up a few times this morning, and I think Philippa in the I Am video said it very eloquently as well. We're all on the spectrums. So these are everybody's issues. And if we can all own them, it destigmatizes the issues for those of us who maybe suffer most from the stigma around these issues. I only have a few slides which I'll flag up to share, and in fact it kind of almost is like a summary of so much of what has come up this morning, but I'm just going to flag them up once more, because one of the themes that I was very pleased to see coming through this morning is intersectionality, and that's really, really important in LGBT Ireland's work, because while we are there creating visibility and equality and advocating for the whole of the LGBTI plus community, as you'll have heard through the morning, there are some groupings or cohorts within our community who are even extra invisible and extra on the margins, even of the LGBTI plus community, talk less of society generally. Why, I suppose I want to say, I made those points already, there is still a huge need for training. So continue from today, please. Get in touch with Belong To, get in touch with LGBT Ireland, get in touch with TENI, so that you can access our training. I think while Ireland has made tons of progress on our issues and many other social issues, we have a terrible legacy of not talking about sex and sexuality and anything to do with that. Our schools and our sexuality and relationships program, young people still report awful, poor, feedback about that training. So there's just somehow a real discomfort around talking about these issues, and that keeps us always on the back foot and always with our guard up. And I think if the majority people heterosexual cisgender people aren't comfortable talking about sex and sexuality and gender identity, then it's so much harder for us who are in the minority position. So please continue your learning from today and get in touch with us and get more training. Because when have you had your opportunity to learn about these issues? You know, where we don't get it at school. We hardly get it in the media. When we do, it can be sensationalized. It's not very educational. It's not giving, you know, it's all quick. It's not giving you a time to just get your core foundational concepts. Ask the questions that are in your head that you're afraid to ask because you don't want to offend someone if it's the wrong words you're using. Everybody needs, I'm an educator, everybody needs their time, their safe learning time. And that's what can help you to turn yourself into an LGBTI plus ally, to come out, to feel comfortable and confident to come out as an LGBTI plus ally, and to spread that allyship across your colleagues and your service, and to transform the services that we rely on when we're vulnerable. I suppose it's come up again through the morning that equality and equity, you know, are quite different. If we're saying, but we give a very good equal service to everyone, that is not one size fits all. Treating everyone the same is not going to capture our community, and other minority communities, because we're not all starting at the same level playing field. There's all different barriers that our community face, and then even other intersectional identities within our community face multiples of those barriers again. So we need to think in terms of equity. How can we ensure that we're doing the additional invitations, the additional communications, the additional visual signals and cues in our services so that everybody can see themselves invited and to feel safe with us? How are we communicating that? As I said, I was so heartened to see intersectionality come through the seminar today as a strong theme, because, and perhaps, you know, that's where our community is at as well. It's a sign of progress within our community that we're now able to take stock of who is seen within our community, who is well supported, and now who isn't. And let's put the spotlight there. Let's give priority there to ensure everyone is coming into the rainbow spotlight of Ireland. Paula mentioned earlier in the morning about our Life in Lockdown survey. I suppose just to remind you again that just for the LGBTI plus respondents generally, a higher percentage of them reporting a decline in their mental health compared with the general population and how their mental health was impacted. So 62% of our community versus 51% of how the general population's mental health declined. So for us as a minority, you know, lockdown was a difficult experience. And then for the minorities within our minority, even much more difficult experience with older LGBT people, 64% reporting a decline, LGBT asylum seekers, 90% reporting a decline in their mental health. We'll see why in a moment. And again, for LGBT travelers, 85% reporting a decline in their mental health. So
we're running out of time.
Okay.
Quickly, sorry.
Not at all, not at all. So just flagging up, Dil, a point you mentioned earlier that the LGBTI plus community is not without prejudice. And I think for LGBT travelers, they get caught between a very difficult, often a very, you know, negative reaction initially in their own families and community when they come out first. Then they come to the LGBT plus community and they experience anti-traveler racism. So LGBT plus travelers are incredibly vulnerable. And if we want to communicate in our service and as mental health professionals that we are there for them, we need to develop a bespoke, you know, a tool to reach them, because a general poster will not reach LGBT travellers because they're already multiples of layers of discriminations back from an LGBT settled person. Likewise, LGBT plus people living in direct provision, they are already traumatized at least 3 times, if not more, by the time they're living in a direct provision centre. Trauma from back home in their native country, trauma of the journey getting here to Ireland, and then the trauma of living in direct provision. Geographical isolation, all of these centres are scattered across the country, often on the edges of the edge of town. Emotional, psychological isolation because they're often sharing bedrooms. So their closet has, really shrunk through having to live in direct provision and they're not out. Anybody who is out in direct provision experiences a lot of negative harassment, and that reminds people who aren't out to not come out because it's definitely not safe. In LGBT Ireland, we do have a multi-peer support group for LGBT plus people living in direct provision. So I suppose they're telling us firsthand the difficulties they're facing. Again, older LGBT people, Sean so beautifully spoke this morning. If all of us, even in our sector and the mental health sector, want to reach out to older LGBT people, again, let them know that they exist. A general poster probably won't be enough. You need to develop a specific invitation. So we need you to do the coming out. That's one of the big messages from today. And this is an active thing. It's not just that you feel supportive of us. Thank you for feeling supportive of us, but you need to turn that feeling into action. And I suppose my suggestion is that your continuing action will be continuing training until you feel comfortable enough and confident enough with the language around our community, the issues around our community, and that our training has trained you in how you can truly make your LGBT, your practice, your space, LGBTI plus aware and inclusive, and how you can communicate that. I'm just going to say, get in touch through our website or directly with me there if you do want to access training. So that's me, Dil. Sorry for the extra time.
Thanks. Was you meant to finish at 1:30, and yeah, we're still here. We have Q&A to do still, and Francis Black is going to be joining us as well. So very quickly, there's Francis. You're there. You're already here. Okay, we're running a little bit behind. I hope that's okay. Okay, phew. So if I can ask the panelists to switch on your videos. So Aileen, Vanessa, Colette, I literally have one question for you, because I think this is an area that needs to be highlighted. Because absolutely CPD, continuous professional development training, that's out there. But the fact is, a lot of people don't feel it's, sometimes the person has to decide to do that training. They have 30 hours, a psychotherapist has 30 hours a year. Where you're going to put that in? And usually people kind of look for trauma or this or whatever, but maybe not LGBT. Core training. And you mentioned in Colette, as a trainee psychotherapist in my 3rd year in doing my BA in psychotherapy, you spent 2 hours talking about sexuality and gender, and wow, that's it for the whole 4 years. So there's people coming out of my training thinking, hey, I can work with anybody, give me anyone. So what can we do to try and create more awareness, whether it's the colleges, whether it's the accreditation bodies, for them to realize that currently the training that's there, the core training, is not fit for purpose when it comes to providing inclusive services for the LGBTQI plus community. So a very quick answer from the 3 of you, please. Who's going to take it?
Let me just get my tuppence in first. I just think that all of the research that was cited this morning, whether we were talking about Visible Lives from 2011, right up to Belong to School Climate Report 2019, Life in Lockdown Report 2020. I think the research is telling us our mental health services aren't, they're just not being accessed by our community to the extent that our community wants to access and needs to access them. And the mental health profession has to ask themselves why. Why is that? Why are we not feeling safe to come to you? Why are we feeling like we have to ring the National LGBT Helpline to know where can I get an LGBT plus supportive therapist? Because we don't feel safe to go to the general profession. So now it could be negative experiences in general society in previous parts of our lives, and therefore we assume we're going to get a negative. So some of the barrier could be imagined, but I think we have a lot of anecdotal evidence to also suggest it's experienced. We have had negative, and you mentioned your own at the very start of the morning, Dil. I think you said 10 times before you found it. Exactly. Yeah. So I think, you know, the research is really the challenge to the profession. We're here, we're ready to train. So why aren't you coming?
Aileen, if I can ask you around the core training, what do you think?
Well, I suppose in terms of my own training, when I was training as a psychiatrist, there was no mandatory training at all. Things have moved on a little bit. You know, I suppose the College of Psychiatrists of Ireland do now have one learning outcome in terms of gender and sexual identity each, but I think it needs to go a bit further. I think they do need to really break down what are the core basic elements that, you know, every trainee psychiatrist needs. And that probably is at least, I'd say, minimum of 1 day training, but I think it's time very well spent. And I do think it needs to be mandated so that, you know, everybody has core basic training that's working on the front line.
Vanessa, final word to you, because we have to go to Francis Black after this.
Do you want me to sing before Francis comes on?
A woman's heart.
Oh, Jesus, yeah. I think, you know, it probably needs to go further than that. You know, I'd love to see, you know, LGBT and especially trans representation in the school curriculum, as far back as we can go. Let's not try to be dealing with this when people have undertaken their training, whether they're 20 or 30 or 40. Let's go into the curriculum, into primary school, secondary school, have it on all the modules, all the specific modules that needed to be on in third level institutions. You know, I'm delighted to say, like, at the moment, I'm on 5 different modules in colleges throughout Ireland, trans-related training, and that's including endocrinology. So again, like, this is a new thing. Again, on the psychology degree in 2 different institutions as well. This is where we need to be, but it needs to be a bigger institutional change. Giving out stink over things. We need to absolutely really change 100%. Trainings available to absolutely everyone. I'm not sure about making it mandatory. You know, I would rather people who would want to come to the trainings themselves, but maybe they're mandatory in the curriculum. Maybe that they're part of their training, whether it's psychology or psychiatry or endocrinology or social care workers. I think maybe it should be embedded in that. And I'm starting this. I mean, I'm not saying that it's not happening. It is happening, but it is happening slowly. It is happening slowly. So maybe when them rocks disappear from either side of that, there will be a gush of training coming forward. So I'm positive about it. I think it's going to happen. But at the same time, we need to keep pushing that, all of us together. I think we're going to do this, but we can't do it as one person. We can't do it as one organization. We need to do this collectively.
Thank you.
Heart. And now a woman's heart.
Yes. Stop. You're putting pressure on the senator now. You're not going to ask her to sing. That's not fair, because I'm sure she gets that. She gets it all the time. So a huge thank you to Colette O'Regan from LGBT Ireland, Aileen Murtagh from St. Pat's for joining us, and of course Vanessa Lacey from TENI, the Transgender Equality Network of Ireland. So now over to Senator Francis Black, chairperson of the Oireachtas